Also known as Lou Gehrig's disease, it's a disorder that affects the function of nerves and muscles. More than 5,000 people in the U.S. have ALS and are diagnosed with ALS each year.
Yeah, my pap Jim included. So Roseman University is inviting the community to discuss the disease in their upcoming Neighborhood Health Series.
Yeah, it's tight.
ALS is a disease that affects what are called the motor neurons, which are the nerves that travel from the brain down into the spinal cord, and the nerves that come out of the spinal cord and go into the arms and legs. And so ALS basically typically starts in one body part, usually asymmetrically. For example, it might start in one leg or a foot, or it might start in a hand, or it might even start in the throat muscles. And it causes progressive weakness and muscle twitching, and then it gradually and relentlessly goes to different parts of the body. And pull towards you and push towards me.
Dr. Ginsberg is an absolute amazing neurologist here in Las Vegas, Nevada. He has educated myself and my wife with the disease of ALS we knew nothing about. He has educated us with ALS, and he's been treating her with a wonderful medication that has slowed down the process.
We don't know what causes it, and there are probably multiple causes. We know about 10% are hereditary. There's no cure. There are a couple of medications that we use to try to help slow it down. The peak incidence is typically 50s and 60s, but I've seen patients as young as 19, and I've seen patients in their 80s with it. And it typically affects people in their prime of their life, and sadly it tends to affect the nicest people you'll ever meet.
All the clinic here, the help that he brings into his office, they're all amazing, amazing people.
10 or 11 years ago, I was approached by the local ALS Association to start developing a multidisciplinary ALS clinic because of my background, and that's sort of how we got everything started, and it's just grown from there.
If you're lost and your partner has been diagnosed with ALS, you definitely need to come see Dr. Ginsberg in the clinic here, and they'll put your mind at ease and moving forward with the ALS process, so you'll be at ease and be able to live a little bit better than with stress every day, because you can't live like that.
We try to educate them, and we try to provide all the support that we can in conjunction with the ALS Association. And again, that's where the multidisciplinary clinic comes in.
She's very grateful for Dr. Ginsberg and the clinic here we get to come to. And
anybody interested in learning more about ALS and how they can help, they're welcome to attend the ALS event that I'm putting on through Roseman University at the Summerlin campus on April 18th. I'll be talking about ALS treatments and a little bit of science behind it. And the local ALS Association is always looking to receive money to help with clinical services and to help fund research.
And a little bit more about that health series that he was just talking about. Roseman University is putting it on Thursday, April 18th from 5:30 to 7 p.m. You can also give them a call at 702-802-2872 or go to speakers.com. I'm sorry, speakers.roseman.edu. It's important information. I want to make sure I get it out there correctly.